Morning, ladies, gentlemen. Today we will talk about topographical anatomy of the upper limb. It's a new subject for you. There will be some differences. Please don't make mistake. Don't think that between the normal anatomy which you studied before and topographical anatomy there are no differences at all. There are very big differences because main methods of topographical anatomy and what for it exists is not similar to the normal anatomy. Today, on example of the topographical anatomy of the upper limb and shoulder girdle, I'll explain to you and I'll show to you what the difference and what you must pay special attention. So, extremity superior or upper limb. It contains of shoulder girdle and free upper limb. Free upper limb contains of arm, which we can divide in anterior region and posterior region of the arm. Then elbow, which we can divide in the anterior and posterior elbow, and then forearm or antebrachial, which we also can divide into the anterior and posterior parts. The last part of the upper limb is hand or manus, which we can divide into the radiocarpi, carpal region, metacarpal region, and digital region or radiodigiti, fingers. Except this, in the hand, we can distinguish palm and dorsal cephas, regiofacies palm and manus, regiofacies dorsi manus. The same as regiofacies digiti palmaris and dorsalis. In the shoulder girdle, we can distinguish four regions. They are regioscapularis, regio-infraclavicularis, axillary region or regioaxillaris, and deltoid region or regio-deltoideal. In the free upper limb, we can distinguish following regions. First, arm. In the arm, we can describe anterior and posterior regions. Next, cubital region, regiocubiti. In it we can distinguish anterior and posterior regions, regiocubiti anterior and regiocubiti posterior. Then forearm. In forearm, regioantebrachial anterior and region antebrachial posterior. Palm, radiopalmar manus, radiodorsimanus, and regionis digiti. Palmaris and consequently dorsalis. Now, let's talk about regions of the shoulder girdle. Scapular region. My dear friends, I'll tell you now algorithm, plan, which you must always use during studies of the regions of the human body. So, first of all, you must say about name of this region in English and in Latin. Scapular region or region scapularis. Second on which you must pay special attention is landmarks. Landmarks are following. It's a spina scapula. You can see it here. You can palpate it, and it's a good point for orientation. Then acromion, the special apophysis, which is projection. Then medial and lateral margins of the scapula. These margins you can also palpate, and of course inferior angle of scapula. Inferior angle scapula. Third, borders. The borders are superiorly line which pass from acromia clavicular joint to the spinous process of seventh cervical vertebra. Inferiorly, it's a horizontal line which passes through the inferior angle of the scapula. Inferior angle of the scapula. Inferior angle of the scapula. Medially, it's a medial border of the scapula, medial margin of the scapula. And laterally, it's a posterior margin of the deltoid muscle and posterior axillary line which pass vertically down from posterior margin of the axillary fossa. Skin, thin, movable, is limited. Its movement is limited. Superficial fascia contains a few layers. Fibrous connective tissue fibers, perforate subskin fat and make fixation into the skin and fascia proper. That's why its mobility is very, very small. All fascia is presented by poorly developed plane. Muscles rest in two layers. Muscles rest in two layers. We can divide them into the superficial and deep. To superficial they belong latissimus dorsi muscle, latissimus dorsi muscle, latissimus dorsi muscle, and trapezius muscle, and trapezius muscle. Deep layer is presented by the proper muscles of the scapula, supraspinous muscle, musculus supraspinatus, infraspinous muscle, musculus infraspinatus, musculus infraspinatus, small rounded muscle, musculus teres minor, musculus teres minor, and musculus teres major. All are covered by the deep fascia, which have the image of aponeurosis. In scapular region, as you can see also here, we can distinguish two bone fibrous cavities or spaces. First one is supraspinous and second one infraspinous. Supraspinous is formed by the same name fossa supraspinata, and supraspinous fascia, fascia supraspinata. Main part of the space is filled or occupied by supraspinous muscle, musculus supraspinatus. Musculus supraspinatus. Supraspinous muscles here. Musculus supraspinatus. Between muscle and floor of the supraspinous fossa, in the small amount of the adipose tissue present, suprascapular artery and suprascapular nerve and suprascapular vein. Here also past branch of the cervical trunk. Infraspinal space. Infraspinal space. Infraspinal space. Infraspinal space. It's formed by the same name fossa infraspinator, infraspinal fascia infraspinator. Here is also muscle, infraspinous muscle, infraspinous muscle. Ramus descendens, arteria transversa colli. In the scapular region, we can distinguish, in the scapular region, we can distinguish in the scapular region, we can distinguish formation of the arterias scapular circle. It's formed by circumflexor scapular artery, which pass throughout trilateral foramen, pass throughout lateral margin of the scapula, perforate infraspinous fascia, and pass into the infraspinous adipose space for forming of the anastomosis with the arteria suprascapularis and ramus descendens, arteria transversa colli. Both are main collateral way for supplying of the upper limb in cases of trauma, of axillary artery. And as you remember, axillary artery, it's a main or dominant vessel in formation over anastomosis. Main passing of the pus purulent masses from the scapular region are: first, external triangle of the neck from the space between trapezius and supraspinous muscles. Second, where travel the pus, travel these purulent masses? In subdeltoid region from supra and infraspinous fossa. Third, in the axillary fossa, infraclavicular region, regio infraclavicularis. Infraclavicular region or regio infraclavicularis. External landmarks: sternum, clavicle, acromion, third rib, pectoralis major, deltoid muscles, and the group between them, sulcus deltoida pectoralis. Sulcus deltoida pectoralis. Bonus. Superiorly, clavicle. Inferiorly, it's a horizontal line which pass throughout third rib or in male, or superior margin of the mammary gland in female. Medially, it's external margin of the sternum, and laterally anterior margin of the deltoid muscle. Vessel's nerve bundle, which contain over subclavian part over brachial plexus, pars infraclavicularis, plexus brachialis, and subclavian artery and vein are projected on the middle of the clavicle. During fracture, it usually tends medial part of the clavicle up. Infraclavicular region layers, skin, movable, subskin fat presented normally. very good development of subsequent fat are in female. Here rests supraclavicular nerves from the cerebral plexus, but main part is supplied by the intercostal nerves. Also, as you remember here, travel, here travel, also here travel, supra, here also travel, suspensorium, mamma, ligament. Ligament which make fixation and presentation of the memory gland. Proper fascia, proper thoracic fascia, fascia pectoralis, contains of two layers, superficial and deep. They cover pectoralis major muscle and form to it a special vagina. Arteria thoracoacromialis pass to the subpectoral space from the axillary fossa and divide here into three main parts, like pectoralis branch, ramus pectoralis, deltoid branch, ramus deltoideus, and acromion branch, ramus acromialis. They travel in the same main regions. Deep fascia start from the inferior surface of the clavicle, from the acromion, and first rib, and from vagina to the subclavis and pectoralis minor muscles. Subclavis and pectoralis minor muscle. On the inferior margin, pectoralis major muscle, it attaches to the pectoral and axillary fascias and close subpectoral space inferiorly. Crepitral fascia in different regions have different development. Its external part from the ligament that support axillary fossa. Ligamentum suspensorium axillum. Because it pulls axillary fascia to the clavicle and make fixation it in such position. Clavipectoralis fascia on all distal of its passing from the anterior wall of the axillary fossa. Posterior to the pectoralis minor muscle rests vessel nerve bundle that exit from the inferior surface of the clavicle, usually on the middle part, and travel to the axillary fossa. Main part of passing of a pass. From the infraclavicular region, the purulent masses travel to the deep subpectoral space. Second, to the superficial subpectoral space. Third, to the pleural cavity throughout the intercostal spaces. Fourth, subskin space between the fibers of the greater pectoralis major muscle. Greater pectoralis major muscle. Number 5. In the axillary fossa from the deep subpectoralis space. Number 6. To the free margin of the anterior wall of axillary fossa from the surface of subpectoral space. Subpectoral space. Deltoid region. Radiodeltoid. Borders. Anteriorly and posteriorly, edges of the deltoid muscle. Superiorly it's a external 1/3 of the clavicle plus acromion, and inferior it's a line which connects inferior margins of the big pectoral and latissimus dorsi muscle, inner leg latissimus dorsi muscle. But in some textbooks you will see another description of the borders of the deltoid muscle, like borders of the deltoid muscles are equal to the borders or to the margins of the deltoid muscle. Deltoid region have a shape of triangle, apex of which pass inferiorly, like you can see here, and the base superiorly. Deeper to the skin and subskin fat and superficial fascia rests proper fascia which form vagina to the deltoid muscle. Deep to the deltoid muscle rests the same name adipose space, spatium subdeltoidum. Spatium subdeltoidum, in which rest vessels in the bundle and also tendons of the muscles which attach to the proximal end of the humerus bone. The dominant vessel of this region is a posterior artery, which surround humerus. Arteria circumflexa humeri posterior, and branch from the axillary artery. It passes here throughout quadrilaterum foramen. Quadrilaterum means 4 angles. Together with the same name vein and axillary nerve, except posterior artery, arteria circumflexa humeri posterior, in subdeltoid space pass arteria circumflexa humeri anterior. Layers: skin, subskin fat, superficial deltoid fascia, propofascia, deltoid muscle, propofascia by the deep layer, subdeltoid space, then subdeltoid synovial bursa, tendons of the supra and infraspinous muscle, fibrous capsule of the shoulder joint, How the pleural masses pass from the deltoid region. The main ways of passing are into the axillary fossa, throughout vessels nerve bundle, supra and infraspinous spaces of the scapula. Next, in the skin of the deltoid pectoral groove, sulcus deltoid pectoralis, into the middle space, of this region. Axillary region, Axial region bounded anteriorly by the inferior region of the greater pectoral muscle, musculus littoralis major, posteriorly inferior region of the latissimus dorsi muscle, medially it's a line which connects ends of these muscles, and this line must pass on the level of the third rib laterally, the same line, but which pass on the medial surface of the arm. Inside over axial region rest, inside of axial region rest axillary fossa. Walls of the axillary fossa are following: first, anterior border, anterior wall, greater and lesser pectoralis muscle, pectoralis major, pectoralis minor muscle. Posteriorly, it's latissimus dorsi muscle, latissimus dorsi muscle. Greater and lesser teres major, teres minor muscle, and subscapular muscle, Medially, it's the lateral side of the pectoral girdle, pectoral girdle, up to the fourth rib, to the anterior serratus muscle. Lateral, it's a humerus bone with a cover it coracobrachialis muscle and short head, caput breve, of biceps brachii muscle, Layers: skin contains of hair, sweat and sebaceous glands. That's why here sometimes we can see purulent processes or inflammatory processes, during which can form hydroadenitis and furunculosis. Subskin fat develop very poorly proper fashion, face axillaris. Thin on the end and thick in the center. Axillary cavity is filled by adipose tissue, in which rest vessels and nerves and lymphatic nodes. Here are present triangles clavipectoral, pectoral and subpectoral triangles. We will talk about it now. These triangles, trigonum clavipectorale, contains of main or dominant vessel nerve bundle. Pectoral triangle rests medially, and here medially rests axillary vein, laterally to it axillary artery, and infraclavicular part of the brachial plexus here divided into three main fasciculi in three main parts. Fasciculus medialis, fasciculus lateralis and fasciculus posterior. Consequently, from what side they surround axillary artery. Subpectoral triangle rests more medially, here rests axillary vein, laterally to it axillary artery, and fasciculi of the brachial plexus, which divide here on main part over the branches like ulnar nerve, median nerve, radial nerve, musculocutaneous nerve, and some another. On the posterior surface of the axillary fossa present two openings, which consequently have the shape of triangle called as foramen trilaterum, and four angles, foramen quadrilaterum. Medially, as you understood, rests foramen trilaterum. It's formed by teres minor muscle and subscapular muscle superiorly. Inferiorly, pectoralis major muscle. Laterally, long head over triceps brachii muscle. Here also pass circumflexa scapular artery. Foramen quadrilaterum, superior formed by the teres minor muscle and subscapular muscle. Inferior pectoralis major muscle. Pectoralis major muscle. Medially, long head of triceps brachii muscle. Here. And laterally, sagittal neck of the humerus bone. Sagittal neck of humerus bone. Throughout quadrilateral foramen pass axillary nerve, which give rise branches to the musculus deltoideus, musculus teres minor, shoulder joint, and circumflexa humerus posterior atria. Lymphatic nodes. Lymphatic nodes of axillary region, nodi lymphatic axillaris, are presented by five. Are presented by five groups, which are apical lymphatic nodes, nodi lymphatic apicalis. They rest in trigononuclear pectorale and collect the lymph from another lymphatic nodes and partly from the mammary gland. Try to remember, main part of these lymphatic nodes are collectors of the lymph from mammary gland. That's why during cancer of mammary gland they must be checked, must pass a revision in the first appointment. Central lymphatic nodes. Second group, nodi lymphatici centralis. Rest in the center of the axillary fossa. They take the lymph, they collect the lymph from superficial lymphatic vessels of the upper limb, thorax, and part of lymphatic vessels of the mammary gland. See, once more, mammary gland. Third group is the lateral lymphatic nodes, nodi lymphatici lateralis. They rest near the lateral wall of the axillary fossa and collect the lymph from the upper limb and mammary gland. This is the third time mammary gland. Next, thoracic lymphatic nodes, nodi lymphatici pectoralis. Rest on the way of lateral thoracic atria, on medial wall of the axillary fossa, and collect the lymph from the anterolateral surface of the pectoral girdle, abdomen, and mammary gland. Next. Subscapular lymphatic nodes, nodi lymphatic subscapularis. They rest on the posterior wall of the axillary fossa and collect the lymph from the axillary region and brachial, and shoulder joint. Lymph from the nodes of the axillary fossa, consequently from the upper limb, some part of the thorax, abdomen, and all upper limb and mammary gland, collect into the subclavian trunk. Subclavian trunk. Right subclavian trunk joined into the subclavian vein or venous angle, but the left one joined into the thoracic duct, ductus thoracicus, or in the left venous angle. During development of a cancer of mammary gland, metastasis in lymphatic nodes of the axillary fossa usually pass in 70 to 80% cases. More long development of it, more bigger percent of passing. During this, very important to make checking of the Zorgius node. It's one of few lymphatic nodes which rest on the level of the third rib, deeply to the greater pectoral muscle. Very often, it's only one damaged by the cancer of mammary gland, Purulent masses travel from the axillary fossa into the subdeltoid region, prescapular region, subclavian region, deeper to the greater pectoral muscle on the anterior wall of the thorax, in the anterior muscle facial cavity of the shoulder girdle, and posterior muscle facial girdle of the arm. Articulatio humeri, or simply shoulder girdle. It formed by the head, of humerus, caput humeri, and the joint cavity, joint surface, cavitas glenoidalis, scapula. On the superior surface of the joint rests acromial fornix, which formed by the acromion and coracoacromial ligament. The joint bursa of the shoulder joint surround the head of the humerus and finish on its anatomical neck. Articular capsula is reinforced by some ligaments. The main ligament from them is coracohumeral ligament. It travels from base of the acromion to the greater tuberculum, of the humerus bone. The rest, ligamentum glenohumerale, anterior, superior, medius, inferior, they are not so strong and attach from one side to anatomical neck of humerus and from another to the joint lip. Near the joint are present few bursas. They are subdeltoid, subacromial, subscapular, subcoracoid. And few recesses. They are axillary, subscapular, and intertubercular. Blood supply of shoulder girdle is by the circumflexor humeral anterior, circumflexor humeral posterior, and arteria thoracoacromialis. Veins drainage in the same name veins which empty into the axillary vein. Innervation by the axillary nerve and suprascapular nerve. Brachial region, radiobrachialis. Boras, superior border is formed by the line which connect pectoralis major and latissimus dorsi muscle. Inferior border is rest on two transverse fingers superior to the condyles of the humerus bone. On skin near the internal and external margins of the biceps brachii muscle rest two sulcus. Sulcus bicipitalis medialis and sulcus bicipitalis lateralis. Sulcus bicipitalis medialis and sulcus bicipitalis lateralis. They are borders between the anterior and posterior groups of the muscles of the arm. Anterior group, sulcus bicipitalis medialis, is more deeper and is a place for location and place for location, place for location, and place for location, place for location, place for location of the vessel nerve bundle. Anterior region. Skin, movable, subskin fat, contains of subskin vessels and nerves. In sulcus bicipitalis lateralis rest lateral vein of the arm, cephalic vein. It empties into the axillary vein. In sulcus bicipitalis medialis rest medial vein of the arm. Medial vein of the arm. It called vena basilica. It joined into the brachialis vein or sometimes in axillary vein. It passed together with the medial cutaneous nerve of the forearm, nervus cutaneus antebrachioidealis. On the medial surface of the arm rest branches of the cutaneous nerve of the arm, nervus cutaneus brachioidealis, and intercostal brachial nerve. From the lateral side rest Superior nerve of the skin. Nervus cutaneus brachii superior. Nervus cutaneus brachii superior. Which is a branch of the axillary nerve. In the inferior part of the arm, from the radial nerve, originate nervus cutaneus brachii lateralis inferior. Fascia of the arm surround the muscles of the arm and give rise to septums to the bone, which called as septa intermuscularis brachiomedialis and septa intermuscularis brachiolaterales. They separate anterior group of muscles from the posterior. On the anterior surface, in the anterior compartment, rest biceps brachii muscle, cora brachialis, and brachialis muscle. Consequently, posterior compartment is filled by triceps brachii muscle and anconus. In the anterior compartment, in the sulcus bicipitalis medialis, rests dominant vessel nerve bundle. It presented by the brachial atrium, which travel together with the two brachial veins and median nerve. Posterior region of the arm. Posterior region of the arm contains consequently posterior compartment in which rests triceps brachii muscle. Between the triceps brachii muscle and bone formed a canal, which called as canalus muscularis. In the older nomenclature, it called as canalis spiralis, or simply spiral canal. Canalis spiralis. In it rests radial nerve. It's the biggest nerve of posterior surface of the upper limb, because radial nerve innervate all formations of the posterior surface of the arm, forearm, wrist and hand. And also here rest arteria humeri posterior. Arteria humeri posterior. Very near location of the radial nerve near the bone is a very big trouble during especially fracture of the middle part of the bone. Cubital region. Cubital region. Cubital region. Cubital region. Cubital region is rest or bounded 3-4 centimeters superior to the line which connect both condyles of the humerus bone. Inferiorly, inferiorly it will be 2 fingers inferior to the end of the cubital joint. In it we can distinguish anterior cubital region and posterior. Anterior cubital region. In the subskin fat rest superficial vessels and nerves. Laterally will be cephalic vein which travel to the sulcus precipitalis lateralis. Cutaneous nerve antebrachial lateralis, which is continuation of the musculocutaneous nerve, and medial vein of the arm, vena basilica. Vena basilica. Both veins connect by anastomosis and have a shape of Russian letter E by the intermediate cubity vein. This anastomosis can be beginning of the intermediate brachial vein. So end of the intermediate brachial vein. Posterior region of the cubity. Superficial fascia movable. All fascia have deep fixation to the bones apophysis, to the lateral medial condyles of the ulnar bone. Through the fascia between two heads of the ulnar and humerus muscle, musculus lacer carpi ulnaris, the ulnar nerve us to the anterior surface of the forearm and rest in the sulcus ulnaris antebrachium. Articulația cubitii. Articulația cubitii. Elbow joint. Elbow joint, as you can see here from this picture, is formed by three bones. One, humerus bone, ulnar bone, and radius. Ulnar and radius. Humerus, ulnar, and radius. This way here formed three joints. Humeroradial, humerulnar, humeroradial, and radio-ulnar proximal. In humerulnar and humeroradial, usually you can make flexion, but in radio-ulnar proximal and humeroradial, we can make pronation and supination. Pronation and supination. Pronation and supination. Joint capsule is participating in formation of three ligaments: collaterale radiale, collaterale ulnare, and the last one, annular radii. Innervation of this joint is by the median, ulnar, and radial nerves. Radial nerves. Forearm can be divided into the anterior and posterior. Anterior forearm. Anterior forearm. Skin thin, in subscale fat, res cephalic, wing, cotyledonous antebrachial lateral nerve. From the ulnar side, vena basilica and nervus cotyledonous antebrachial medialis. All fascia or fascia antebrachial proper cover the muscle which form to it vaginas. We can distinguish four layers of the muscles. First layer include brachioradial muscle, pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris muscles. Second layer, flexor digitorum superficialis muscle. Third, flexor digitorum profundus muscle. And fourth, musculus pronator quadratus. between the brachioradialis and flexor carpi radialis muscle rests a radial groove, sulcus radialis antebrachii, which contains of radial artery in the company of two radial veins and superficial branch of the radial nerve. Medially, inside, between the musculus flexor carpi ulnaris and flexor digitorum superficialis, rests ulnar artery. It contains of arteria ulnaris together with the two ulnar veins and nerve. Ulnar nerve rests internally to the vessels. Sides of these two grooves formed median groove, sulcus medianus antebrachii. It contains of medianus artery, comitans mediani nerve, and interossus anterior artery. Posterior region. Muscles here in the posterior region rest in two layers. They are superficial and deep. Superficial include extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris. In the deep layer rests supinator muscle, adductor pollicis longus muscle, extensor pollicis brevis muscle, and extensor indicis. Regiomanus can be divided into them. Regiocarpi, region of the carpus, the borders are proximally line which rests on 1 cm superior to the styloid process of the ulnar and radial bones, and distally it's a parallel line to the first row of it. In the carpus region we can distinguish anterior and posterior region. Anterior region or regiocarpi palmaris. It formed three grooves, superior, middle, and inferior. Here form three canals: canalis carpi radialis, canalis carpi ulnaris, and canalis carpalis. Canalis carpalis is a place where pass 9 tendons, 4 tendons of musculus flexor digitorum superficialis, 4 tendons of musculus flexor digitorum profundus, and 1 tendon of flexor pollicis longus. On the posterior region we can distinguish 6 canals. First, travel tendons of abductor pollicis longus muscle and extensor pollicis brevis. Second canal, pars tendon over musculus extensor carpi radialis longus and musculus extensor carpi radialis brevis. Third one, pars tendon over the extensor pollicis longus. In the fourth canal, pars tendon over the extensor digitorum and extensor indicis, and also intercostal nerve. In the fifth, pars tendon over the extensor digiti minimi and tendon over the extensor carpi ulnaris muscle. Extensor carpi ulnaris muscle. Bones are presented here by 8, which rests 4 in each row. 2 rows and 4 in each. First row, proximal, scaphoid, lunatum, triquetrum, pisiform. And second distal, formed by the trapezium or mutangulum, trapezoidum, capitatum, and hamatum bones. Joints. Here form the articulatio radiocarpea, articulatio mediocarpea, articulatio carpometacarpea, and articulatio carpometacarpea pollicis. Innervation formed by the radial, median, ulnar, cutaneous antebrachymedial, cutaneous antebrachiolateral nerves. Here I can show to you small picture of the operations of panarisiums. Thank you very much for attention, cooperation and patterns. If you have some questions, write on the wall. Thank you. Goodbye. Please, chief students, don't forget to send me information about who present, who absent. Goodbye.